First, what is pulmonology?
Most people don't know what that is, and so I just tell people I'm a lung doctor.
You're a lung.
So I take care of asthma patients, COPD, lung cancer, pulmonary fibrosis, and just generally people who are short of breath.
Okay, and it is Lung Cancer Awareness Month.
It is.
So what should somebody do? Who needs a screening? When should they come see you?
So about 15 years ago, the NIH published this huge multi-center, multi-decade trial for how to effectively screen for lung cancer. So it had been tried with chest x-rays, but now anyone between 50 and 80 who's an active smoker or who has quit within the last 15 years should get something called a low-dose chest CT. So this is like a scan of your lungs, but it just uses about 1/4 of the amount of radiation as a normal CT.
Okay, and then, so we're in cold and flu season, that can affect your respiratory. When should somebody come to the doctor instead of hiding out at home and waiting to see?
So if you get a bad cold and it just feels worse than you would normally feel, and particularly if you're above the age of 65, any chronic health conditions, you want to go and get swabbed so you can find out if you have influenza or COVID, because there are effective antiviral treatments for both of those.
Are you seeing a lot of that right now?
Not so much, except I had COVID 6 weeks ago.
Really?
Yeah, I got it from a patient. So,
yeah,
I've had a bad luck streak for the last couple of years.
I've never had COVID.
Oh,
knock on wood.
Yeah.
But
Yeah.
so if somebody is having these symptoms and they come and see you, what are some of the warning signs?
So I don't typically see that many acutely ill people. That's typically seen in urgent care in the emergency room. But if someone has a high respiratory rate, a high work of breathing, a high fever, and they put the little pulse oximeter on and it's below 90%, those are all big red flags.
Okay, and you work at a rural hospital.
I do.
Can you talk a little bit about rural hospitals and why that's so important?
It's crucial, especially for a state like Iowa. So I trained at the University Hospital. I did my residency and fellowship there, and then I worked at the hospital formerly known as Mercy, Iowa City, for 15 years, and then I have been at Washington for 3 years. And it's the best job I've ever had. So I mean, it's like a small place. Everyone knows each other. And the leadership is really got a vision about where the hospital wants to go, and we serve a rural population. So many of my patients are farmers, and they will not come to the doctor unless it is really bad.
Yes, I know a lot of people like that.
And a lot of them won't go past Washington. They don't want to go to Iowa City. They don't want to come to Cedar Rapids, and so. We're able to see people and provide a really high level of care, and we're able to do a lot of things that can be done at bigger hospitals, but in a small, kind of comfortable setting.
Are things changing this year with Medicaid and coverage?
Yes, and so Iowa has, I think, 82 rural or critical access hospitals, and already before Medicaid cuts, about 20% of them are in danger of, failing financially. And so, and even, Washington is a very financially healthy hospital, but even there, we could lose $10 million a year from Medicaid cuts. And what that does is that lowers the margin of the profit that the hospital can make, and that means you can't replace equipment, you can't give people raises, and if you can't keep up with bigger places, the doctors, the nurses, the techs, they're gonna go elsewhere.
Yes, and we need people in rural communities. Tomorrow is National Rural Health Day, actually.
Oh, I didn't know that.
Yes, well, surprise, it is. So you can celebrate tomorrow.
Okay.
But yes, thank you for being in that area and providing care. Anything else people should know about Washington County Hospital and clinics?
So, we have a working relationship with the University Hospital. We have Epic through them. And I actually send quite a few patients to Mercy Cedar Rapids because the turnaround time is really quick. And so we can do a lot. And then when we reach a point where we need to go to a higher level of care, we have really excellent relationships with the surrounding hospitals.
Wonderful. And website where people can get more information?
You'd have to ask.
I think we have it popping up on the screen. There you go. Here we go.
All right.
Yes, you can call the number. There's the website. Thank you so much.
Sure.
What about a tip for Justin, who seems to be having a cold?
You know, like lay low and chicken noodle soup and Tylenol and
There you go.
ibuprofen and just take it. He should probably just like go home and just take it.
You heard it, Justin. You can go home. Doctor said. Thank you so much, Dr. Ashby.
Sure, absolutely.
Yes.
Thank you.